Behavioral therapy. Behavior. Behavior is adaptive, maladaptive. When it is age inappropriate, interferes with adaptive functioning, or others must misunderstand it in terms of cultural inappropriateness. Behaviorism sees psychological disorder as the result of maladaptive learning, as people are born tabula rasa, a blank state. Basic assumption is that the maladaptive behavior can be corrected through the provision of adequate learning experiences. Behavioral therapy, a form of psychotherapy, the goal of which is to modify maladaptive behavior patterns by reinforcing more adaptive behaviors. Principles of behavioral therapy, theory of classical conditioning, which involves learning by association and is usually the cause of most phobias. Theory of operant conditioning, which involves learning by reinforcement, that is reward and punishment, and can explain abnormal behavior, such as eating disorders. There is social learning theory and cognitive behavioral approach. Assumption of behavioral therapy. First, based on principles and procedures of scientific method. Second, deals with clients' current problems as opposed to analysis of historical determinants and factors influencing them and factors that can be used to modify performance. Clients expected to assume an active role by engaging in specific actions to deal with their problems. Emphasizes teaching clients skills of self-management with expectation they are responsible for transferring what's learned in office to everyday lives. Focus on assessing overt and covert behavior directly, identifying problems and evaluating change. Emphasize a self-control approach in which clients learn self-management strategies. 7. Intervention individually tailored to specific problems. What treatment by whom is the most effective for this individual with that specific problem and under which set of circumstances. Based on collaborative partnership between therapist and client, clients informed about nature and course of therapy. Emphasis on practical application intervention applied to all facets of life in which maladaptive behaviors are to be deceased and adaptive behavior are to be increased. Therapists strive to develop culture specific procedures and obtain clients' adherence and cooperation. Indication of behavioral therapy. First, obsessive compulsive disorder, post traumatic stress disorder, depression, social phobia, bipolar disorder, schizophrenia, autism, personality disorder, substance abuse, and eating disorders. Behavioral therapy techniques, systematic desensitization, flooding, therapeutic graded exposure, participant modeling, assertiveness training, social skill training, aversion therapy, shaping, Premack principle, extinction, token economy, contingency contracting, covert sensitization, and timeout. Systematic desensitization. It is developed by Joseph Wolfe. Steps. First is relaxation training, relaxation procedures, physiological effects. Relaxation produces physiological effects opposite to those of anxiety. Hierarchy construction, 10 to 12 conditions in order of increasing anxiety. Desensitization of the stimulus, gradual exposure of individual from least to most anxiety provoking situation in a deeply relaxed state. Suitable for anxiety disorder, phobic anxiety, obsessive compulsive disorder, and certain sexual disorders. Flooding and implosion. No relaxation, no grading. Exposing the individual directly with the situation based on the principle that escaping from anxiety reinforces the anxiety through conditioning. Prematurely withdrawing from the situation may reinforce the phobia, not suitable for clients with heart disease and fragile psychological adaptation. Therapeutic graded exposure. Therapeutic grade exposure is similar to the systematic desensitization, except the relaxation training is not involved and treatment is usually carried out in real life context. Participant modeling. In participant modeling, patients learn a new behavior by imitation, primarily the observation without having to perform the behavior until they feel ready. Usual, useful in phobic children. Children with problem are placed with children of own age and sex who approach the feared situation together. Assertiveness training. Assertiveness is a response that seeks to maintain an appropriate balance between passivity and aggression. Assertive responses promote fairness and equality in human interaction based on a positive sense of respect for self and others. Assertiveness training is a form of behavior therapy designed to help people stand up for themselves, to empower themselves in more contemporary terms. Social skills training. Social skills training is a form of behavior therapy used by teachers, therapists, and trainers to help persons who have difficulty relating to other people. A major core of social skills training is teaching persons who may or may not have emotional problems about the verbal as well as non-verbal behaviors involved in social interactions. Examples of social skills are eye contact with others during conversation, smiling when greeting people, shaking hands when meeting someone, using the right tone and volume of voice, expressing opinions to others, perceiving how others are feeling and showing empathy, appropriate emotional responses, that is crying when something sad happens, laughing when someone says something funny. Aversion therapy. When a noxious stimulus punishment is presented immediately after a specific behavioral response. Theoretically, the response is eventually inhibited and extinguished. Types of noxious stimulus: electric shock, substance that induce vomiting, corporal punishment, and social disapproval. Aversion therapy is suitable for alcohol abuse, paraphilias, impulsive and obsessive behaviors. Shaping. A method of training by which successive approximations toward a target behavior are reinforced. Shaping or behavior shaping is a variant of operant conditioning. Instead of waiting for a subject to exhibit a desired behavior, any behavior leading to target behavior is rewarded. Speech therapy in autistic child suitable. Primack principle. The Primack principle was derived from a study of Cebus monkeys by Professor David Primack. Primack's principle suggested that if a person wants to perform a given activity, the person will perform a less desirable activity to get at the more desirable activity. That is, activities may themselves be reinforcers. An individual will be more motivated to perform a particular activity if they know that they will be able to partake of a more desirable activity as a consequence. R1. R1 is frequently occurring response, R2 is less frequently occurring response, allowing R1 to occur only after R1. R1 is telephone talking with friend. R2 is completing homework. Completion of homework may get incentive of telephone talking. Extinction. Extinction is observed in both operantly conditioned and classically conditioned behavior. Extinction as a procedure occurs when reinforcement of a previously reinforced behavior is discontinued. As a result, the frequency of that behavior decreases in the future. Extinction in temper tantrums. Token economy. An operant technique applied to groups such as classrooms or mental hospital wards involving the distribution of tokens or other indicators or reinforcement on desired behavior. The tokens can later be exchanged for privileges, food, or other reinforcers. Contingency contracting. A contract is drawn up among all parties involved. Desired behavioral change is expressed in writing. Contract is made for the reinforcement of compliance and punishment for non-compliance. Restitution and overcorrection. Restitution means restoring the disturbed situation to a state that is much better than what was before the occurrence of problem behavior. For example, if a patient passes urine in the ward, he would be required to clean the dirty areas, but also mop the entire larger area of the floor of the ward. Timeout. Timeout is an aversive stimulus or punishment during which the client is removed from the environment where the unacceptable behavior is being exhibited. The client is usually isolated so that reinforcement from attention of others is absent. Reciprocal inhibition, also called counter conditioning. It decreases or eliminates a behavior by introducing a more adaptive behavior, but one that is incompatible with unacceptable behavior. That is relaxation exercise for the phobic patient. Oversensitization, a type of aversion therapy, that is disulfiram, for the person who wish to quit the alcohol. Oversensitization, individual's imagination to produce unpleasant symptoms rather than on medication. The individual learns through mental imagery to visual nauseating scenes and even to induce mild feeling of nausea. Exposure and response prevention. is a treatment method available from behavioral psychologists and cognitive behavioral therapists for a variety of anxiety disorders, especially obsessive compulsive disorder and phobias. Advantages of behavioral therapy. Behavioral therapists use empirically tested techniques, assuring that clients are receiving both effective and brief treatment. Evidence-based therapy are a hallmark of both behavior therapy and cognitive behavior therapy. Most studies show that behavior therapy methods are more effective than no treatment. Emphasis on ethical accountability does not dictate whose behavior or what behavior should be changed. Address ethical issues by stating that therapy is basically an education process. An essential feature of behavior therapy involves collaboration between therapist and client. Disadvantages of behavior therapy. Behavior therapy may change behaviors, but it does not change feelings. Behavior therapy ignores the important relational factors in therapy. Behavior therapy does not provide insight. Behavior therapy treats symptoms rather than causes. Behavior therapy involves control manipulation by therapist. Thank you.